I'm Dr. David Steffens, professor and chairman of the Department of Psychiatry at UConn Health. It's my pleasure to welcome you to tonight's special program that will address the topic of whether spirituality plays a role in healthcare. So it is a great pleasure, and in a sec I will do a longer introduction, but it is really a great pleasure to welcome Dr. Harold Koenig, who is a longtime friend. We trained together at Duke University 20-something years ago, and graduated the same residency class, and we're colleagues at Duke for many years until I came northward to enjoy the balmy weather up here for 2.5 years ago. But we've definitely kept touch, and it's just great to have Harold come up. It's my pleasure to introduce Dr. Harold Koenig. Dr. Koenig is director of the Center for Spirituality, Theology, and Health at Duke University Medical Center, and has published extensively in the fields of mental health, geriatrics, and religion, with over 450 scientific peer-reviewed articles and book chapters and more than 40 books. His latest book is titled Health and Well-Being in Islamic Societies. He completed his undergraduate education at Stanford University, nursing school at San Joaquin Delta College, medical school training at UC San Francisco, and geriatric medicine, psychiatry, and biostatistics training at Duke University Medical Center. Dr. Koenig is currently board certified in general psychiatry and formerly boarded in family medicine, geriatric medicine, and geriatric psychiatry, and is on the faculty at Duke as professor of psychiatry and behavioral sciences and associate professor of medicine. He's also adjunct professor in the Department of Medicine at King Abdulaziz University, Jeddah, Saudi Arabia, and is in the School of Public Health, Ningxia Medical University, Yinchuan People's Republic of China. His research on religion, health, and ethical issues in medicine has been featured on dozens of national and international TV news programs, including ABC's World News Tonight, The Today Show, Good Morning America, The Dr. Oz Show, and NBC Nightly News. Over 100 national or international radio programs, and hundreds of newspapers and magazines, including Reader's Digest, Parade Magazine, Newsweek, Time, and Guidepost. Dr. Koenig has given testimony before the U.S. Senate and U.S. House of Representatives concerning the benefits of religion on public health, and travels widely to give seminars and workshops on this topic. He's a recipient of the 2012 Oscar Pfizer Award from the American Psychiatric Association and the 2013 Gary Collins Award from the American Association of Christian Counselors. I will also say we have a phrase down south, good people, and that refers to somebody's kindness, integrity, willingness to do what they say they're going to do. Dr. Harold Koenig is good people. We like I said, have been colleagues for nearly 30 years, and have really valued his friendship. He wears many hats. I am a geriatric psychiatrist. We claim him in geriatric psychiatry as well. Speaking of which, I will put in a shameless plug for our growing geriatric psychiatry programs here, specializing in geriatric mood, anxiety disorders, as well as dementia. So we do have that growing program both within the Department of Psychiatry as well as in geriatric medicine as well, where we have mental health providers as well. So my shameless plug. With that, I will say welcome to you, my friend, Dr. Harold Koenig. We really look forward to your presentation.
Thank you, Dave. All right. And thank you all. Thank you all for coming tonight. And hopefully that will be the last problem that we have tonight is going to be with that. Okay. So, I wish I could see you all out there. I can't really see you very well. But I see there's a lot of you out there, which is wonderful. Thank you for coming out at night. You know, it's tough to get out at night, 7 o'clock, especially when it's cold out there. So thank you all for making the effort to be here. Okay, so I'm going to address this topic. Is spirituality good for your health? And I'm sure that many of us are wondering about that. Maybe one of the reasons you're here tonight is now. Is it possible to get the mic? There's a ringing sound in the back. Can we turn it down a bit? Yeah. Okay. Let's work on that. Let's just blast ahead here, and there we go. Okay. So this is kind of a summary of what I'd like to talk about. First of all, I'd like to define some terms, particularly words like religion and spirituality. Then I'm going to talk a little bit about the early research prior to the year 2010. Then talk about a little bit of the recent research we've been doing at Duke, so you kind of see what kind of work that I do there. And talk about how to integrate spirituality into healthcare and some of the reasons for doing that. And then finally, provide you with some further resources if you'd like to follow this area a little bit in the future after this talk. So, where is our audio person? You're working on that? Are we working on it? Wherever he is? Okay, good. So really the most controversial area in this entire field has to do with definitions. So terms such as religion, secular humanism, and spirituality may be dear to our hearts. I mean, we may choose one over the other, and to have some guy stand up and say, well, here's the definition, that sometimes rubs people the wrong way. These are the definitions that I'm going to be using for this particular talk. They are not universal by any means. They're just, definitions. Okay, so maybe a little better. Yes. A little better? Okay, yeah? Good. Okay, so religion involves beliefs, practices, rituals related to the transcendent, where in Western traditions, the transcendent is also called God, Allah, Hashem, a higher power. In Eastern traditions, it may be called Vishnu, Krishna, Buddha, or ultimate truth and reality. Religions usually have doctrines about life after death that rules to guide behavior here on earth. Religion is often organized as a community, but can also exist outside of an institution and may be practiced alone and in private. Okay, so it doesn't have to just be institutional religion. It can also be private practices, private beliefs that one has that I would term as religion. Okay? Then there is secular humanism. And secular humanism is a term that involves viewing human existence without reference to religion. In other words, God, the transcendent, a higher power, or ultimate truth, where the focus is on the rational self, science, and community as the ultimate source of power and meaning. Okay, so now we get to spirituality. According to the traditional definition, spirituality was the core of what it meant to be religious. In other words, describing those who were deeply religious, living a life dedicated and surrendered to the divine. The modern definition of spirituality, however, has become much broader, including not only those who are deeply religious, but those who are superficially religious and those who are not religious at all. In other words, secular humanists. Okay? So that's kind of the way it is these days, but it's fairly recent. The notion that there could be spiritual people who were not religious is something new. It's something relatively recent. for about the last 20, 25 years. In fact, you know, the first time the word spiritual or spirit was used was in the Bible. I believe it was the second verse of Genesis, or it might be the second chapter, but it talks about the Spirit hovering above the waters. And so, you know, that's kind of where it started, I think. But now it's changed, and that's okay, but we just have to realize that, you know, when we're talking about research and clinical practice. Okay, so the main points I'm trying to make is that religion is more specific and easily measured and is a more useful construct when conducting research that seeks to identify specific characteristics of the individual that prevent disease. So spirituality, religion is what you can measure, okay? And that's what usually has been measured, and now a lot of the research that I'm going to talk about has to do with religion. Spirituality, on the other hand, is very hard to measure because no one can agree on what it is. And in science, you have to be able to measure things, and you have to have a common kind of definition that everyone agrees upon. Like we agree upon blood pressure. You know, what is a normal blood pressure, what is not, what a normal blood sugar is, what is not. There's an agreement, so we can then study that and look at relationships with it. So a lot of the research I'm going to be talking about tonight has to do with religion. Now, I'm going to switch, however, when I talk about application, because spirituality, because of its broad and nebulous nature, is the perfect word to use when engaging patients in clinical settings, when you want to start a dialogue with them. You really don't care about the definition. You want to start where the patient is, wherever that is, and they will. That may be religion. That may not be religion. That may be meaning and purpose, or sense of connectedness, or it may be talking about their favorite hobby or nature. It can be almost anything, and you begin there. So spirituality is a great word for application. And I'll be talking about taking a spiritual history and meeting spiritual needs. And in that respect, it's nice and broad, and it can mean anything patients want it to, and that's where you start the dialogue. But before we get there, we need to find out what are relationships between religion and health, because that's what you can measure and quantify. Now, not everyone agrees with me on this. I just want to acknowledge that. I've got some rational reasons for doing it this way that, you know, I'm happy to answer maybe in our answer, you know, session after this. Okay. So, let's talk a little bit about the past research. I'm going to look at coping with illness, which is very important. It's a very important role that religion plays and probably underlies the mental and physical health effects that we'll talk about later on in the talk. I'll review some of the research on religion and mental health, social health, and look at health behaviors, and also then ultimately at physical health. Now, what about, let's turn now to religion as a coping behavior. Many people turn to religion for comfort when they're in some kind of a difficult circumstance. Whether that be a loss of a loved one, or just even a loss of a job, any stressful circumstance. And for many of the people that I take care of, they're dealing with medical illness. And that's something that strikes just about everyone. People get sick. People become disabled. They have to deal with chronic pain. They can't work anymore. They can't, you know, their position in the family changes. Lots of things to cope with when you get sick. Lots of them. And religion is often used to cope with those things. Religion often used to cope with things such as uncertainty, fear, pain, disability, loss of control, and discouragement and loss of hope. You know, this loss of hope is a big one. It's a big one. Hope for a better future. Hope for something beyond the illness. Hope for something, beyond the loss of a loved one. It's a big thing. I think we underestimate that. Now, in terms of coping, in the United States, there is a lot of religious coping going on. No matter where you are in the U.S. Here was what Americans did. This is a national random sample after September 11th. And this was published in the New England Journal of Medicine. And what they found was that 9 out of 10 Americans coped by turning to religion. 90% coped by turning to religion. This was about 5 days after September 11th. Now the question is, does it help? Does it really help? Does turning to religion help with your emotional health, with your physical health, with your social relationships? Does it make a difference? And that was my question. That was my question 30 years ago. I had heard so many things from preachers. I heard it was good for you, and then from colleagues and from mental health professionals that it wasn't so good for you, that was related to neurosis. And I knew some pretty neurotic religious people, and I also knew some pretty stable religious people. So I figured, okay, well, why not use the tools of science that they teach us in medical school and nursing school and psychiatry? Why not use those tools to look at the relationship between religion and health? Why not just measure religious involvement, measure various health outcomes? There are many scales for all sorts of mental, social, physical health outcomes, and see what you find. I just wanted to find this out for myself. Back 30 years ago, I thought, well, I'm just going to do a study. I was advised against it. Believe me, I was advised against it. They said, this is the anti-tenure factor. If you go here, you're not going anywhere. And, this is just not something that doctors look at. And you can't measure it anyway. How are you going to measure this? I said, well, why can't you just ask people how often they go to church? They would, that's a little personal. You don't do that. How often they pray? That's even more personal. You better not do that. And so I said, well, I'm just going to do it. So I did it. I made up measures and administered them, and then had people respond, and lo and behold, there were some correlations. That was, earlier today I was talking about the most amazing thing that I've ever discovered. It was a fact that, and I hadn't discovered it, people a long time ago had been discovering it, but the fact that you could actually measure these things and find they were correlated given the complexity of both topics. In other words, how complex religion is, and certainly spirituality. How complex it is. And it's not static. It's changing over time. People are constantly changing, or some might say, moving along the spiritual path as they grow older, as they go through trauma and stress and illness. Not only that, but health is changing. Our mental health, our physical health, our relationships are constantly changing. So how on earth can you look at the correlation between two moving objects? It's very hard. And the fact you can show anything must mean that there's a pretty strong relationship. Okay, so here, if you're interested in, I'm going to summarize this research. If you're interested in locating it, looking at it, the studies are all in these 2 editions of the Handbook of Religion and Health. Okay, 2001 Oxford University Press and 2012. Okay, so let's look at religion and mental health. Let's look at depression. Depression is the area I started out studying in the medically ill.
And that's what I was initially very much interested in. And still doing research in that area, but it's the most common emotional disorder found in people with medical illness is depression. About 20% of patients in the hospital, these are just randomly selected people in the hospital, 20% have a major depressive disorder. Now this is on the medical services, this is not on psychiatry. This is on just medical services, cardiology, neurology. 20% have a major depressive disorder, most of it not diagnosed, and 20% have a minor depressive disorder in which functioning is impaired, but the symptoms aren't quite as severe. So it's very crowded, 40% of patients in the hospital. Now, if you look at the research out there, there have been about 444 studies, 61% of which find that religious people are less depressed. They're less depressed in those 61%, and they are less likely to get depressed. They recover more quickly from depression, and religious interventions seem to lower depression in 61%. Now, if you look at the higher quality studies, you actually find that even a higher percent are likely to find that. Now, 6% of studies report that religious people are more depressed. So this is a systematic review of the literature. So all studies, no matter what the findings are included here. But that gives you kind of a sense of what the research is showing. Now here's a study in JAMA earlier, about a year ago. And the title of this is Neuroanatomical Correlates of Religiosity and Spirituality. Now we're talking about something a little bit harder than just responding to a questionnaire. Now we're looking at brain functioning, MRI scans, functional MRI. Okay? So these are the researchers at Columbia University in New York in the Department of Psychology. So what they found was the following. Well, first of all, they had several generations of people with depression. They had the initial generation that had major depression. Then they had their children and their grandchildren. And what they did was they identified those children and grandchildren that were at high risk for depression because a parent or grandparent had a major depressive disorder. They then looked at their brains. And what they found as a group was that those at higher risk for major depression because of a parent or grandparent having depression had parts of the brain that were smaller, that were reduced in size significantly compared to those who were not at high risk for depression. And so that was a finding they reported. Then what they did, they divided the group into two groups, those with high risk for depression. One group indicated that religion was very important in their life, and the other group indicated that it was not. It was somewhat important or not at all important. So here are the findings. On the left-hand side are the brains of individuals for whom religion was not very important, and on the right-hand side are the brains of those for whom religion is very important. If you look at the red areas, these are the areas of the brain that are reduced in cortical thickness. They're reduced in size. You can see here that there is a lot more red in these brains compared to these brains. Just compare them across. This to there, that to there. And so what they concluded was that people who are more religious, that their brains are different from those who are less religious, particularly if they're high risk for depression. And the question was, does religious involvement actually allow those shrunken areas of the brain to expand? We don't know the answer to that, but I believe that they're currently doing a study to look at that. But it would be consistent with these findings. Now, it also appears that emotional disorder is different among those with major depression if they're religious. Okay? So if you look at a sample of people who have major depressive disorder, everyone has major depression, and you look at their positive emotions. You look at emotions like meaning and purpose, optimism, hope, gratitude, thankfulness, generosity. If you look at those positive emotions, they're actually different in people who are more religious versus less religious. Now, everybody has major depression. You've got to remember that. And in the next slide, it shows this difference. If you look at the rate of depression, this is measured by the Beck Depression Inventory. Now, all these people, there's 132 people in this sample, all with major depression. So since they all have major depression, depressive symptoms don't really vary much across religiosity. This is low religiosity, and these are quintiles of religiosity. So it doesn't really matter how religious you are because everybody's got major depression. But it does matter how religious you are with regard to the positive emotions, like hope, like meaning, like generosity, like gratitude. You can see that it goes nicely up with increasing religiosity. So depression appears to be different in people who are more religious. Suicide. Now, since depression is less common, people recover more quickly. Suicide is less common among those who are religious in the vast majority of studies. There have been 141 of these studies, all quantitative, all in peer review journals, medicine, neurology, psychology, social sciences. Of those, 75% show that religious people just have fewer suicidal ideation, more negative attitudes towards suicide, just don't commit suicide as often, don't attempt suicide as often, etc. And one reason might be because religion gives people a reason for living. It gives them meaning, even in the situations that seem to have, seem to be pretty bleak. It gives them a sense of hope and meaning in the darkness. Now, if you look on the other side of things, you also find that not only are religious people less depressed, but they have more positive emotions in general, whether they're depressed or not. So here is 326 quantitative studies, and of those, 79% show that those who are more religious have greater well-being. They're simply happier. They have greater life satisfaction. And of those 326 studies, only 3 studies find lower levels of life satisfaction, happiness, or well-being. So that's a lot of research published in peer-reviewed journals, published by people who don't do research in this area, published across the United States, from every state, from many different countries throughout the world. So here was a study we did back a long time ago. It was in the early, mid-'80s. And this is one of my first studies. Remember, I was telling you I was amazed that you could actually show that they're even correlated. And this was one of those studies. We just measured church attendance, and we had a measure of intrinsic religiosity that some people actually equate with spirituality. It's more a personal form of religious devoutness that some people kind of say these are spiritual individuals. But in any case, you can see that well-being goes up in almost a stepwise fashion. It's, the relationship is, it's kind of like the way, a drug works. You give a person an antibiotic, and you look at their blood levels of bacteria. You give them a certain level, they have a little bit more. It's stepwise, it's incremental, which is important in a research study. If you find an incremental finding like this, this does suggest that there is a relationship there. Now, it's not just with well-being. If you look at studies of meaning and purpose, you find that 93% report greater meaning and purpose among those who are more religious, more hope in 3/4 of studies, more optimism in a lot of the studies. And all of the above have consequences for patients' motivation for self-care and efforts towards recovery. So if you've got somebody who has a life that has meaning and purpose, they're going to work harder in rehab to get better. If you have someone who has hope for better times ahead, they're going to be more motivated to take their medication because they see some reason for doing it. If they're more optimistic, they're going to again see the benefits down the road, and they're going to be more than likely to reach those benefits than if they were pessimistic about or hopeless or feeling like nothing that can be done really is going to benefit them. Now, alcohol use and abuse, 86% of the studies, hundreds of studies, a lot of them in young people, the majority in young people, high school, college-age students, right at the time when these young people are developing habits that will affect their health for the rest of their lives. Illicit drug use, basically the same finding. I really don't have to dwell on this. Social health, social support, vast majority of studies finding more social support among those who are more religious, especially older adults. You know that for decades, studies have found that the greatest source of support for most older adults outside of their family comes from their religious organization. It's a very consistent finding over time. Delinquency and crime, 104 quantitative studies, again close to 80% show inverse relationships between religious, spiritual involvement and delinquency or crime. The highest quality studies show the same thing. And interesting, this is one of the most interesting things I think, that of studies published in the last 10 years between religious or spiritual involvement and school performance. In other words, grade point average or graduation rates from high school, every single study reports that religious youth do better academically. Every single study. Let's look at marital relationships. Greater marital stability, less divorce, greater satisfaction within the marriage, less spousal abuse, more likely to have an intact family with two parents in the home. In, again, the overwhelming number of studies. Health behaviors. Religious people are more likely to exercise. Isn't that amazing? I can understand this with Catholics. The Catholic who goes to church and have to kneel and stand and kneel and sit, kneel and stand. That's plenty of exercise. And of course, if you're in an African American church, it's a lot more than that. Yeah, they're standing and jumping and yelling and hollering, and there's a real church service going on there. Plenty of exercise. There is one form of exercise, though, that is less frequent among the religious, and that is the risky sexual practices, in, again, 86%. Now, there is a problem. There is one problem. We'll go over this quickly. It has to do with weight. Religious people just simply weigh more than everybody else. There's no way around it. Those potluck suppers. Okay, so cigarette smoking. We know that cigarette smoking is not good for your health. And of the 135 studies, 90% find that religious people just don't smoke as much. They just don't smoke as much. And they don't start smoking, interestingly enough. They don't start. It's not all that they quit that more frequent than those who are less religious. It's they don't start. A lot of times don't start in youth, particularly if they're raised in a religious home. Here's a slide out of North Carolina. I seldom show this in North Carolina, but you're in Connecticut. I figure you're not raising too much tobacco out there in the snow. But in any case, you can see that smoking goes down with increasing religious attendance. And even the number of pack years smoked goes down. So they're just not smoking as much. And that's got to have some effect on health. So let's look at physical health. And, as you would expect, blood pressure is lower in the majority of studies. Cardiovascular functions are better in the majority of studies. And there's less coronary artery disease among those who are more religious. Here's a study we did looking at blood pressure, large sample of older adults in North Carolina. You can see that the average diastolic blood pressure goes down nicely with increasing religiosity. Note, though, however, these two graphs compared to these two, and the big jump that occurs here. So if you go to church, you're just going to church and you're not praying much or reading the Bible, there's not that much of a difference from not going to church and not reading the Bible or praying. So isn't that interesting? The jump is where you have, even if you've got low religious attendance and there is a high level of praying and Bible reading, you've got a lower blood pressure. And then, of course, if you do both, you've got, the synergistic effect. Now, this is out of Israel. This is 10,000 men prospectively followed for 25 years, showing that those who are most orthodox in their religious practices, and what that means is that they go to synagogue, they practice the Jewish rituals in the home, and they send their child to a Jewish school. Those are all considered to be indicators of religiosity. So those who score in the upper 20% on that scale are termed the most orthodox, have about a 20% lower likelihood of dying from coronary artery disease in Israel. Now, immune and endocrine functions also in the majority of studies seem to be better. So the basic physiological processes in the body that are affected by stress levels seem to be functioning better among those who are more engaged in religious practices or meditation. This is the first study looking at religious practices and inflammatory markers. IL-6 here is a cytokine. It's an indicator of inflammation. And this is big now in medicine. Inflammation is thought to underlie lots of different diseases, especially vascular disease, where inflammation of the arteries causes plaque, resulting in stroke and coronary artery disease. So if you look at religious attenders, they even after controlling for the ability to get to church, if you control for functional status, they have lower levels of inflammation. Now, in general, mortality studies show that religious people live longer. And that's what you would expect if better mental health, better physical health, and better social relationships, you would expect greater longevity, and that's what you find in the majority of studies. And in fact, of the best studies, the largest samples that have followed people the longest times, you find that 3/4 of those studies report greater longevity. Now here's a study out of Dartmouth. Now I think Dartmouth is close, right? New Hampshire is pretty, not too far away. Good. If you live in New Hampshire, you could probably be okay here in Connecticut. But if you live in New Hampshire, you better be religious. Particularly if you're having open heart surgery. And this is what they found. They found that those with high religiousness and high social support, which a lot of times came from their faith community, had 1/14 the mortality within the 6-month period after open heart surgery. 1/14. That was after controlling for other risk factors, including the severity of the heart disease. So some of these relationships are pretty strong. They're not all this strong. This is one of the strongest studies, admittedly, selected out of many studies. But in some areas, even in areas that are not noted to be very religious, New Hampshire, I think, has the lowest religious attendance in the United States per capita. I think I think Mississippi is the highest, or Alabama, which is interesting given that in general, if you look at the public health level, those are the states with the worst public health. And, in places like Connecticut and New Hampshire have the best health. And you try to figure, well, how is that the case? It's very different when you're studying things at the population level. I think you probably see really bad health in Mississippi and Alabama. There wasn't so much religion going on there. I would just estimate that. I don't know, but, Now, here is the study we did of our 4,000 older adults that we've been following. So those who attend church once a week or more often are living longer. So you think, okay, well, I'm spiritual, but I don't go to church. Well, I'm sorry, you're on this trajectory if you're in North Carolina. There's just no way around it, So if you're going to church once a week or more, that's your survival curve if you're, over 60. And that's the curve for less than once a week. Now, sometimes these reports get mixed up, especially in the media, and people reciting you. So the person who was my editor at the handbook at Oxford University Press, she sent me an email not too long ago. They had gotten a manuscript. Somebody had submitted, and they had said that they've cited you in this manuscript, but we want to be sure we're fact-checking. Did you really say that, did you write that Koenig et al. Followed about 4,000 randomly selected older adults for 6 years and found that frequent religious attendance predicted a 28% reduction in morality? Said, I didn't recall that we reported that, but that T does make a big difference. Okay, so kind of summarizing all of this past research since prior to 2010, this is kind of what the findings are generally. There have been literally thousands of studies. I wish that thousands, 2,500, 2,000, 1,500, thousands of studies, literally. And here are the findings. This means the findings are complex. You can't figure out what they found, basically. The article was so confusing. Negative means that they have worse health the more religious they are. This is a trend towards worse health among the more religious. Then you have mixed findings. That means depending on how you measure religiosity, one measure might show it to be related to worse health, and another measure to better health, depending on how you're measuring it. Then you have some trends in the expected direction, in the positive direction. It's just a statistical trend. It's not actually statistically significant. And then you've got significant relationships, p-values less than 0.05, statistically significant. And then you've got no association. So here are the findings. So you got a few studies that are just too complex to figure out what they found. You've got about 250 studies that show religious people are sicker, worse health, more neurotic. Then you've got a few studies trending in that direction. Then you've got, a couple of hundred studies showing that, both. It's related to both worse and better health, depending on the measure that you look at. Then you find a couple of hundred studies that show that there's a trend towards better health among those who are more religious. And then you have those finding a significant relationship between religion and health, better mental, social, physical health. And then a number of studies showing no association. So that's basically it. That's basically a summary of the research that's in the 2 handbooks of religion and health. All 3,100 studies are listed in the appendices of those 2 handbooks, all of them, described in terms of the sample size, what they controlled for, the population. It's all in there. Okay, so let's look at the latest research at Duke. Very quickly here, religious psychotherapy study. So this is a study we finished about a year ago, and we're still writing papers from it, analyzing the data. And this was 132 persons with major depression and chronic medical illness. This is a randomized clinical trial, randomized to either religious psychotherapy, CBT, cognitive behavioral therapy, or conventional secular CBT. And 65 from Durham, North Carolina, and 67 from Los Angeles County. So from both, it's a multi-site study, both sides of the U.S. Everybody got 10 50-minute psychotherapy sessions by telephone. See, this was in people with chronic medical illness, and we wanted to make it a little easier on everybody. So what we did was we delivered the therapy by phone so that people with chronic illness didn't have to wait in the office of the therapist, didn't have to struggle with driving and all of that. So we did it by telephone. And basically the results are pending. A lot of papers we've written from this study, they're pending. But in 2 weeks, they will be coming out. The original study and the results will be coming out. So in April, it's embargoed. I wish I could say, I can't, because it's embargoed by the journal. There'll be a bunch of press releases, but check out the Journal of Nervous Mental Disease in April. Now this is the second study. 251 stress caregivers surveyed with the questionnaire. So this is a cross-sectional study. Again, half of the sample is from Durham and about half from Los Angeles County. And what we're looking at, we've developed a new 10-item comprehensive and sensitive measure of religious involvement. This is a dynamite measure. 10 items, each rated on a 1 to 10 scale, ranging from 10 to 100. So it's got nice range. It's got great sensitivity. If you look at scores in people with no religious affiliation that are not involved in religion, they're very low. They're like 12 on a scale from 10 to 100. If you look at Chinese college students, we've done it in China too, the average score is around 15 on that 10 to 100 scale. If you look at caregivers caring for a loved one with disabling illness, that's the stress caregivers that we enrolled. You look at them in Durham, North Carolina, they score an average of about 46 on that scale. If you look at caregivers in Los Angeles County, the same score, still around 46. If you look at African Americans, the average score bumps up about 15 points. It's close to 60. And that's well known that African Americans are much more religious than our whites. Whites are down there around in the 30s on that scale. So it's very sensitive. And it's published now. So if you're interested in it, you can go to our website. It's up on our website. You can use it for free. So let me know if you're using it, but you don't have to. You don't need permission. But it's a great scale, and it's now being used in China, and we're planning to use it in Saudi Arabia. It's been translated to Spanish, been used in Puerto Rico, and it literally just came out 2015. It came out about a month ago, and it's already translated into several languages and being used in several populations. We're also looking at caregiver adaptation. And I wish I could show you the slides, can't. Results are pending. And the most interesting study is looking at religiosity and telomere length. Religiosity and telomere length. Now let me show you what I'm talking about. Here is your DNA, your chromosome. You know, we all got cells, everybody's got cells with chromosomes, and that kind of directs the cell what to do. And in those chromosomes is what's called DNA. And this is kind of the chromosome kind of stretched out. At the very, very end of the chromosome is the telomere. This is basically non-coding material. It doesn't have any DNA in it. What's interesting is that when the cell divides and the DNA has to replicate, you got to have another set of DNA for the new cell. when it replicates, it somehow the process of replication eats away at the end of the chromosome. And so in order to preserve the DNA, we've developed telomeres at the end that can be eaten up away as the cell divides. So a telomere is literally a biological clock within the cell. As people age, their telomeres shorten, and it's thought to be able to predict longevity. And this in geriatrics is really kind of the rave these days. And wouldn't it be interesting to look at the relationship between religious involvement and telomere length? Now, why on earth would religious involvement affect telomere length? Well, one of the things we know is that stress levels shorten telomeres. There have been lots of studies, especially in caregivers and in women, showing that telomeres are shortening at a rate among highly stressed women in particular that reduces about 17 years from their lifespan. These are caregivers. So they're shortening a lot quicker among those who are stressed. And the reason for that is that stress increases inflammation. Those cytokines I was talking about earlier, the IL-6s, those are indicators of inflammation, and stress increases inflammation. Inflammation eats away at the telomeres. So if religious involvement reduces stress, then it ought to reduce inflammation, and we've shown that already. What about telomeres? Is this the mechanism by which religion extends longevity? So this is very exciting. Results are pending, except for this slide. This is just in our sample. This is the telomere lengths by age. You can see what the relationship is. We did the telomeres in UC San Francisco in the lab of the lady who won the Nobel Prize for the discovery of telomerase and telomeres. So she has a lab there, and we're able to get these telomere lengths done in her lab, which is using the latest technology. So these are pretty accurate, and you can see from the age relationship that it's very consistent with what's been reported and the physiology. Now, like I said, the results are pending with regard to religiosity. So I think I'm probably way out of time, but I'd like to, and I'm out of time, but let me just very quickly talk about what do you do with this? What do you do with this information? How does it relate to providing health care? Quickly now, right now, this is the situation in health care. There's the doctor, there's the minister, and there's the patient kind of stretched out there. And there's a big divide in between, So that's that. And we're wanting to close up that gap a little. And here are the reasons for doing so. Many patients have spiritual needs related to illness that influence their satisfaction with care and their health care costs. Religion influences coping with illness and affects patients' emotional state and motivation to recover. Religion affects important health-related behaviors and likely influences medical outcomes. Religious beliefs influence medical decisions that patients make, especially towards the end of life, and they even influence the decisions that physicians are making that they don't talk about, they don't mention. Decisions about how much pain medication to give. Decisions certainly about issues related to abortion, birth control, other issues, assisted suicide. All these decisions are being guided in many of physicians by religious beliefs, but these are not discussed with the patient. So, religion also influences compliance with treatments. Even the standards of care by JCAHO require respect for patients' cultural and spiritual beliefs. This is what the JCAHO people go around looking for when they do their checks, because it's one of the standards that hospitals are rated on. So how do you know what to respect if you don't ask? You don't just by osmosis know what the cultural and spiritual beliefs of people are. You need to ask, and that's all we're asking. We just want healthcare professionals to take a spiritual history. That's all. And connect them with somebody who can address those needs. Now I'm going to go through this. This is basically just shows that patients whose spiritual needs are not being addressed by the medical team, they use a lot more medical resources during the last week of life. A lot more. Triple the amount of cost in the last week of life for deeply religious people whose spiritual needs are not being addressed. And that's jacking up the cost of medical care a lot. So what are we asking? Physicians should take the spiritual history. Be open to talking with patients about these issues. That's all we're asking. Respect, value, and support the beliefs and practices of the patient. It's all patient-centered. Identify the spiritual needs of the patient. Ensure that someone meets those needs, not the doctor or the nurse, probably a chaplain, or a pastoral counselor, or a community clergy, depending on who's available and whether they're trained, and if the patient wants. Maybe if the patient wants a prayer and the patient asks, I don't think it hurts. Wouldn't hurt the nurse or the doctor to say a brief little prayer. Probably be encouraging to the patient, particularly the religious patient. Work with the faith community if the patient consents. Work with the, maybe the chaplain could communicate with the community clergy, if the patient consents, of course. And there could be some follow-up, some support, any spiritual needs that were identified in the hospital. Maybe they could continue to be addressed after the patient gets discharged, and support mobilized. Very simple, very, very rational, logical, patient-centered kinds of things that just make common sense. You wouldn't even have to have this boatload, this truckload of evidence connecting religion and health to be doing this. Anyway, just because it just makes sense. And let's see here. Conclusions. Religion is commonly used to cope. It's related to greater well-being, less emotional disorder, less substance abuse, more social support, better health behaviors. Religious involvement is related to less physical illness, better medical outcomes, greater longevity. Spiritual needs are widespread in medical settings, in many medical settings, in the Northeast as well as all those studies. Those are Harvard studies at the Dana-Farber. It's here in the Northeast, lots of spiritual needs present, especially those with serious life-threatening disease. And when you assess and address the spiritual needs of patients, this increases patient satisfaction, increases quality of life, reduces depression, lowers use of unnecessary expensive health services, improves functioning, and is good for the doctor-patient relationship. Time to start integrating spirituality into whole person health care. It's time to start. Okay, so further resources, if you want to look into this more, here's a book. It's the latest edition, 2013, Spirituality in Patient Care. Has chapters for nurses, mental health professionals, a lot of it's for physicians. If you're interested in the research, here's the handbook. This is the 2012 edition. It has all the research. Here's that one in Muslims. This is Health and Well-Being in Islamic Societies. It basically compares Christians and Muslims in research in those populations, as well as across denominations, across, Christians and compared to Muslims. We have a free e-newsletter that I write every month. Put a lot of effort into this. Send out. You get for free. All you got to do is sign up. I encourage you to get it. You got, the latest research, even before it's published. It's literally not even the journals. And I find it, or people tell me about it, and I summarize the results and comment on those results. The latest news in the field, resources that you might use to help you do research, grants, funding opportunities, jobs, literally in this area. Lots of information. It's only about 5 pages. Go to our website. There it is. A lot of information on this website, including the religious CBT study manuals, if there are any therapists in the audience, in 5 religious traditions: Christian, Jewish, Muslim, Hindu, and Buddhist. Right on the website, there's a new, there it is right there, religious CBT study. If you're interested in doing research, we do a 5-day research workshop during the summer, August 10th through the 14th. We really drill it home. This is like a 2-year postdoc crammed into 5 days. So it's very intense. Individual mentorship. You learn how to, even if you're not interested in religion and health, it's a great primer on how to conduct research, how to write papers, how to get funding support, how to write a grant, how to get funding. Send me an email if you're interested. There's my email. It's very simple. My name @duke.edu. And now, I'm a little over, I'm sorry. Let's take a 10-minute break.
Well, good to see you, Dr. Koenig. I have several questions that have been written. If a question comes to mind and you still have a card and want to do that, we can I can grab those from you as well. First of all, thank you again for a really terrific talk on a rather, as you said, complex area. I will say. Unlike your results, our appreciation is not pending. It is tangible and here, and we really appreciate it. I'm going to start in with some questions, and we'll start in with, we'll just start right in. From your perspective, please discuss physician-assisted suicide.
Okay.
There you go. That's right. This is UConn.
Not a controversial subject at all, Dave, huh?
Right.
Okay, so what about assisted suicide? Very complex issue, enormously complex. I've written and done research on it in North Carolina. So, the complexity of it is that it's, if you're suffering horribly and dying, there's grades, in my opinion. This is all opinion. In my opinion, there's grades of risk. That's my opinion. There are grades of risk. The risk goes down, I think, with the degree of suffering, with the degree of real, unrelenting pain and suffering. I think there is still risk. It's my opinion.
So when you say risk, are you, so in terms
I'm
of
referring to
physician-assisted suicide?
I'm referring to moral risk, based on my belief system. And I'm giving you my opinion. I'm not talking from research. I'm just saying, in my opinion, but the moral risk goes down with increasing levels. I can't imagine what I would do if I was, trapped. See, that's part of it. That's part of it. Why I don't just say I think it's wrong. Why I don't just say that God determines life and death, not us. So rather than say that, I'm saying my opinion, which is that the risk goes down with increasing suffering.
That's, thank you. this is a technical question on some of the studies. Why is there lower blood pressure, et cetera, and all those things you talked about in terms of good outcomes for religious folks when they are, in fact, heavier than non-religious folks? How do you reconcile some good aspects of health when you also report that people are carrying around a little extra, you know?
Yeah, yeah. You know, everything kind of adds up. Everything adds up. I mean, you know, imagine what your health would be, you know, if you were large and not religious. It would probably not be so great. But just like I was saying earlier, population studies show that the most obese people are in the South, or in places like Mississippi and Alabama. And they are the most religious. And they have the highest rates of hypertension, and high rates of cardiovascular disease, high rates of stroke. But just imagine if they were not religious. Those rates would be out of the roof, I think. Because on the individual level, when you study individuals rather than at the population level, you find that those who are more religious, particularly in those areas, have better health, have lower blood pressure. They may be, you know, a little bit larger, but they have less cardiovascular disease. They have better health, even though they might eat a little bit more.
Understood.
Eat a better diet, more of the diet, but, you know, a better diet. Actually, that's been shown that the diet is better.
And apparently good tasting.
That too.
So you alluded to this a little bit. Are there clinical models for spiritual assessment? So clinical models for spiritual assessment available, and if so, where can we get them? Okay,
that's a great question. I've got a good answer for that one. Right now, literally last week, we got a grant from the Templeton Foundation to integrate spirituality into the Adventist health system. This is the largest Protestant health system probably in the world. It's the largest in the United States. Catholic healthcare is the only larger one. And there are no Protestant systems that are larger than the Adventist system. So we have developed 5 videos. 5 videos. We've paid over $100,000 to do 5 one-hour long or 50-minute long, 45 to 50-minute long videos to train health professionals. There are 3 for physicians. There is 1 for whom we call the spiritual care coordinator, which is usually a nurse or a clinic manager, can be a social worker. And there's a video for the chaplain or pastoral counselor. And we encourage people to form spiritual care teams, doctors' offices. This is all outpatient, could be just as well inpatient, probably work even better inpatient. To form spiritual care teams that consist of the physician, the spiritual care coordinator, the chaplain or pastoral counselor, the ward clerk or, you know, the receptionist, and social worker if you're in a hospital setting. These are spiritual care teams that identify the spiritual needs, which the doctor does that, not the spiritual care coordinator. It's a very short 3-question spiritual history. We've tested it out. It takes about 1 minute to 2, one or 2 minutes to administer. The doctor does it, records it in the electronic medical record, and then immediately then, if any issues come up, now a lot more the doctor can do, you know, but typically in this system, all we're asking the doctor is to ask those 3 questions and to record the response in the electronic medical record. The spiritual care coordinator then takes those responses, addresses them if they're simple, or then connects them with a chaplain to address any real spiritual needs that are present, and then does follow-up on that, and then feeds it back to the team. the team also supports each other spiritually. So they engage in, occasional times of a spiritual team meeting in which information is shared and support is provided of a spiritual nature. So this is going into the field right as we speak. I think they've already, we actually started before we got the grant, but we have 100 physician outpatient practices. The Adventist system has 8,000 physicians. We're planning to enroll about 400 physician practices with spiritual care teams and prospectively follow them for changes from baseline to 1 month after the teams are developed and get engaged, and then 1 year later, and we'll see how this works. But those 5 videos are all going to be available for free on our website. I'd prefer that you contact me and just let me know, because we have to record just the number of times people watch these videos. But they're for free on the website. You'll be able to click on a link and watch the video. It's got Harvey Cohen in there, and other Schmader.
Yes. So
Ed Schmader.
But yes, lots of luminaries at Duke.
Yeah,
in the
luminaries
Center
at
on
Duke.
Aging. Some of the leaders in the field in geriatric medicine at Duke. Terrific. Well, that's great that they're going to be available on the website.
Yeah.
It sounds like that is a very rich resource. As I recall, one word, spirituality and health.duke.edu, right?
It's something like that.
It's something like that.
Yeah.
That's all they need to know.
That's all they need, exactly.
That's right. harold.koenig.duke.edu.
I'll
right.
send them to the website.
Here's an interesting question. So we know that that insurance companies are interested in promoting good health, and the questioner is asking, have you had any insurance companies asking you about the relationship between religion and healthcare, with an eye towards this may help in terms of prevention and certainly health promotion? Have you ever been contacted or had any working relationship with insurance companies on this issue?
This makes absolute perfect rational sense.
Ah.
And that insurance
So it's
company,
unlikely to have actually happened.
insurance companies are the ones who are going to benefit from this because they're paying for the health care. So why wouldn't there be interest? There has not been any interest. No one has asked me. Now, I've thought about asking for a grant from an insurance company to look at this. I've in the workshop every year for 11 years, I have a slide that says, why not try insurance companies who are the most likely to benefit from this to get at least a grant to study this in a way that could quantify some of the health benefits and cost savings. Now, what I understand, I may or may not be correct on this, it's just hearsay. I understand that ministers sometimes get a break on their health insurance. It probably depends on what part of the U.S. you're in and what your insurance company is. But I hear that there is some break if you're actually a minister, given the fact that ministers do live longer and seem to have, there haven't been studies lately. There's a lot of stress that goes on in being in the ministry these days. It's different.
I'm seeing a lot of heads nodding, yes.
It's different now than it was 25 years ago. There's a lot more stress, but still, in any case, that.
Very good. So this is getting at the difference between religion and spirituality again, trying to get back at definitions, really wanting to get a little bit more clarification on how you define those differences, how you address them clinically, and clearly has implications in terms of the research that you do as well. So that how are they the same? How do you define them differently? That religion and spirituality.
Okay, I use religion. I measure religion when I do research. That's what I measure. Now, sometimes I've measured spirituality. And I do have a daily spiritual experiences scale that Lynn Unruh developed. But that's really measuring mostly religion. I mean, it's talking about God, relationship with God and stuff. It's called a daily spiritual experiences, really measuring religion. The only way I know of to measure spirituality that is not confounded, now if there's any researchers here that are measuring spirituality, very important to hear this, that is not confounded by mental health, I don't know of one. I don't know of a measure. Some of these measures are even advocated by the Institutes of Health, such as the FACET, the Functional Assessment of, the FACET SP. The American, the National Institute of whatever the Cancer Institute is, recommends the FACET SP when you're using research. And I tell people to use it, but it's highly contrary. It's basically a measure of meaning and purpose in life and some kind of vague, nebulous kind of faith subscale, which is confounded by your outcome. I mean, reports are that, that you're more spiritual and therefore you commit less suicide. But you're measuring spirituality by asking people if they have meaning and purpose in life. So, duh, if you have meaning and purpose in life, you're not going to commit suicide as often. And these measures are just like that. They measure spirituality by peacefulness, by connectedness with others. That's how we diagnose anxiety disorders, by asking people, are you having trouble with being peaceful? Depression, are you not connected with others because you're socially withdrawn? These are symptoms of emotional disorder or lack of it that are being measured in these, quote, spirituality scales. The reason why is because there is such a desperation to measure something other than religion. It's sucked in mental health. Literally, items assessing mental health have been sucked into these scales and have confounded them, making the relationships tautological, which is, there's no excuse for that in science.
Right.
That's the scientific argument that there's no defense against.
Right.
So, but I do research, so I measure religion. Spirituality is the word to use when you're dealing with patients in clinical practice. I can't say that more fervently. Use the word spirituality. Don't use the word religion. Use spirituality. You're not trying to measure it. You're trying to engage people. Chaplains know that you walk with people along their journey. You meet them where they are and you walk with them. Okay? And that's how you deal with spiritual issues. And if people want to talk about religion, you talk about religion. They want to talk about a Duke UConn basketball game, you talk about that.
Not after last night.
Yeah, okay. I don't know. I haven't followed it here lately.
Yeah, well.
But anyway, I know the women's team, though, huh? Yeah. There's it. Yeah.
So, on this, speaking more about spirituality, how can medical schools promote, develop, and implement discussion of spirituality for staff, students, and expand to include residency programs as well?
Yeah, the Templeton Foundation is very interested in this topic and has funded Christina Puchalski at GWISH with a lot of money to look at this and to actually give out grants to medical schools that will develop a course for medical students on spirituality in medicine. And we did a survey of the medical schools, all U.S. medical schools, 126, about 5 years ago. We asked the deans to what extent they had included anything in their curriculum for addressing spiritual issues to the medical students. And we had, about 80% said that they had something in there now. Of course, what they defined as spiritual could be, one lecture in ethics, that was spiritual, or something about end of life, decision making, that was defined as spiritual. But to actually have a dedicated course on religion, spirituality, and health, where you actually had a course that was required 7%.
Right.
So that's, and those are like Loma Linda, University of Chicago, and some of the religious schools, basically,
Right.
Adventist schools, etc.
So let me draw you out a little bit more on this. I think one of the concerns for medical students and perhaps physicians in general is how self-revealing to be. And I wonder and how you counsel people. For example, patients do want to feel like they're being understood when they speak, so they may ask, do you go to church? Do you have a faith background? And how do you counsel people who may find that that's off-putting, or they may be struggling with where they are at right now with religion? How do you counsel medical students, residents, and physicians and caregivers in general?
And that's a great point, because, they did a survey, the Dana-Farber guys did a survey of why oncologists weren't asking. And that was one of the reasons, because they were concerned that the patient would ask them what their beliefs were. How do you respond? How do you advise people, clinicians and medical students? If you are religious, you just tell them. Say, yeah, I believe in God. Now, most of the time, what's really the reason for the question? Now, of course, you and I are taught, why do you ask that question?
Right.
But the real reason underlying it is that people are concerned that their religious beliefs will not be respected and honored. Because, there has been a big divide for a century in this area, and sometimes people's religious beliefs have not been respected, and they would like to know. They would like to know if their doctor, has any beliefs. And, I don't know why, but still patients want their doctor to be both their doctor and their priest. And I don't know why that is the case. Maybe because doctors are dealing with life and death, dealing with such sacred areas of people's lives that very religious patients would like to know if their doctor is also religious. Now, if the doctor is not religious, you can respond, you can tell them, if you're not really, you kind of sidestep it a little bit and just say, I want you to know, and do it with real fervor, I want you to know that I respect your faith, and I will do everything possible to ensure that your spiritual needs are addressed and respected in any kind of care that I provide. I will be sure of that. And you do it with that kind of authority.
But Dr. Koenig, you didn't answer my question. I asked you if...
Okay, now if that happens, now that does happen, then you just look at him and you say, are you trying to evangelize me? That's what are you trying to do that now? Really, this is about you now. This is not about me. You do it with kind of a joking attitude. You don't get serious on them, and get offended. See, that's the problem,
Right,
is that you
right.
get offended.
I do wonder, if basically you're just saying, I'm not a religious person, but I respect, but then with great fervor do that as well.
Yeah.
I think, we in psychiatry where patients all the time want to know, are you married? Are you straight or gay? Are you religious? They have all of these things that they really want to ask, and we're taught, and why do you ask that question? But at some point, trying to understand, in terms of patients really do want to feel like you're going to understand them on an area that's of such intense, so intensely personal, but very important to them, that at some point, I think just honesty that we may see things a little bit differently, but I will respect you and do the best I can for you.
Absolutely.
It is hard. It is
hard.
It's hard, and it depends on the profession as well. Because again, we're taught perhaps in a way different as well to sort of wonder why people are wondering. So.
And we do want, we will want to know that too.
Right.
That's part of the response, is to try to. That's really important to you. Can you tell me why? Why it's really important for you to know that I'm also a spiritual, religious person? You could say you're a spiritual person.
True. Here is a very basic question. Why does it work?
Why? Why does it work? Well, you see, what we study, what we can study, is what are the psychological, social, and behavioral mechanisms that then translate into physiological mechanisms that affect health. That's the only thing we as scientists can study. We cannot prove that God exists or God is doing a miracle or whatever. That's just not possible. It's not possible using science, which is rooted within nature, which is observable and, quantifiable usually, and measurable. So the mechanism, we can go along. We can look at telomeres, and we can look at immune functioning and physiology, and we know the mind and the body interact very closely together. And we can look at and verify that. Develop spiritual interventions that might even improve health or improve mental health, and then maybe physical health. So we can do all that. There's a lot that can be done. But it's all based on psychological, social, and physiological mechanisms, whether God exists or not. Whether God exists or not. God didn't exist, then it would work exactly the same way. That we can study. Now, does God do miracles? I believe, my faith says yes. That sometimes God intervenes in ways that are completely unexplainable, that you can't pinpoint, because God's acting outside of time and space. He's not constrained, he or she is not constrained by time, by space.
So do you think then, just following on that, what do you think about intercessory prayer?
Oh!
Do you think God can be influenced then if he's able to perform miracles?
I believe it, Dave. I believe it.
So people who fervently have a lot of faith and believe in intercessory prayer, bringing concerns to God, do you think that is a useful use of their time?
I would encourage it. That's good. That's good. Absolutely. It's useful enough for me to do it. Absolutely. I take 30 minutes every single day to pray for other people. Every single day, except for Sunday. So I think it's worth your time, and I think something happens. I am absolutely convinced. I mean, I know that people are praying for me, and I know that a lot of what's happening in my life is because of that. People who are disabled, who are on dialysis, some of the sickest people with chronic pain are praying for me. And I know that it makes a difference. I know it. And I will die knowing it.
Well put. Yes. So since we have gotten into a little bit of the personal for you, I was wondering whether I was going to ask this question, but since you opened the door, could you share your own life situation when your spirituality helped?
Okay. Well.
And you don't have to answer if you don't want.
Now, I've written a book on that. I did write a book on it, so
yes.
It's out there in public. If anybody wants to read it, it's called The Healing Connection. But I have the honor of being the first medical student to ever have been expelled from University of California at San Francisco. I was expelled in my second year and lived on the streets of San Francisco at a time when people were being pillaged and raped and robbed, and no one even came close to me. I was that scary. So from there, religion brought me back. And what else can I say? And it's really been transformative. It really has been. And it started, interestingly, it started before I came to Duke, but it was when I was on an obstetrics rotation in Missouri. I was a family medicine doc. I was telling you about that. I was doing my rotation, and nobody gave me any babies to deliver because, this was a private hospital. This was like St. John's Hospital. It was a private so nobody was whining. So I was in the call room many hours, and I was going through issues, some relationship issues, girl, guy stuff, and I was very despondent. And I got a copy of the Living Bible. I think just as a whim. I just had a lot of time, and I thought, what else? What else? I'm just despondent. I'm alone in this call room. My relationship's not going well. And I began reading it. And I started from Genesis, and I read all the way through. And it was the Living Bible, so it was very easy to read. And it was like, wow. Like, I can be happy. And I can really be happy, and I don't really have to depend on anyone. Like I was kind of codependent on, in relationships. And I really experienced happiness, and it's maintained itself for 30 years. It's really amazing. I mean, to me, it's just, I'm so thankful. It's a gift. But anyway, my wife would still say a lot of stuff that I'm glad she's not around here to be able to testify to. But in any case.
Thank you. Thank you for that. Any studies done on music and health? A little, perhaps somewhat related, off topic. Any studies done on music and health? I'm not a musician, but I like to hum and sing. Does it help?
I'm sure it does. I'm absolutely sure it does. Now, what I'd love to do is see a study. I'd love to design a study that compares people who are humming and singing a secular song with those humming and singing Amazing Grace and look at the difference. Because, there's been research looking at meditation. That when people meditate and they use just a secular phrase like love or peace, that it has less effect than if you use a religious word. I mean, they've done this in college students where they've taken students and had them immerse their hands in ice water and seen how long they can keep their hands in the ice water and have them meditate. And if a student, these are randomized students, they're randomized to each group. Those who are meditating on a religious word can leave their hands in the ice water longer. So it's interesting. And like with music, I bet you, that's, I think, one of the reasons why they have singing in church is because it has benefits. So absolutely.
Thank you. Those are all the written questions I have. We
Any
might
other?
have time for one or two if there is a burning question from the audience. And if so, please raise your hand, and I will try to spot you.
Somebody back there. Okay.
Ah, yeah. Oh, hello.
I don't know what God's plans are for this young man's life, but I can tell you 100% that your prayers will make a difference.
Keep on praying.
Keep on praying. Absolutely. Because, the scriptures say, raise up a child in the way he should go, and when he is old, he will not depart from it. It doesn't say when he's young. I got a son in the same situation, believe you me. And I not only prayed for, I got a ton of other people praying for this young man. So I know what that's like. It's hell. It's hell. But stick it out. Pray for that young man. And it'll happen.
Yes, sir.
I think it just happens. I think it's just a miracle when it does. And I think it will.
Yes, sir. In the front.
There's a lot about meditation and mindfulness. Like the CEO of Aetna right now has got his people meditating and all, and yoga and
Yeah,
that.
yeah.
And it's very definitely connected with the body and all. And I think you put that under the heading of spirituality, and they can find out, they do test and they do show a difference. And also you talk about music, there's a thing about Alive Inside, where this man has been doing all of this and showing that people with Alzheimer's and so forth, that they don't necessarily remember things, but they come very much more alive. I was wondering if you have anything to say about a lot of the stuff that's going on these days.
I think that's terrific, and I think it definitely making a difference in terms of meditation, in terms of yoga, in terms of breathing. All of those are based within thousands of years of religious tradition. That's their origin. And so I think they are very beneficial. I think I would love to study, the various, we've kind of taken some of those practices and removed them from their tradition, their religious tradition. I'd love to be able to look and compare those practices, separate from the tradition and deeply immersed within the tradition and seeing how they vary.
One last notice is that some of these have shown the medication has been reduced by 30 up to 70%. And you look at that and say, good Lord, wouldn't that be a great benefit for our whole healthcare system?
Absolutely.
Seriously.
Absolutely.
So it is 9 o'clock. If you wouldn't mind hanging around for a few minutes, there may be some people who want to ask you a few
Fine.
questions.
Yeah, absolutely.
Thank you again, Harold, so much for your time, for coming up. Really
Thank you,
appreciate
Dave.
it.
Thank you all. Thank you. Thanks, Dave.